Welcome back to Medicine Deconstructed. I'm Dr. JRutland. We're sitting here in Laguna Beach. You know, I thought today I'd start with a little story. Last week, a 31-year-old male came to the hospital. He had an infection on his backside. He was told by a couple of surgeons that he needed an operation. The 31-year-old, strong, young, said, "No, I don't want an operation. I don't need it." In fact, during his hospital stay, he looked at the surgeon while he was on his phone and asked him to turn the television on for him. Didn't realize how sick that he was. Moments went by. He started to get more and more sick. His organs started to fail. He needed to be ventilated, intubated, which means putting a tube down your throat and having to be on a breathing machine. He needed central access, which means putting a big IV in the center of his body to give his body the nutrition and the medicines that it needs to survive. He made it to the pre-op area, as at that point in time we decided he was gonna have the surgery whether he liked it or not because he was dying. In the pre-op area, I got the phone call, being the intensive care unit doctor. They were asking me for help. I went down to the pre-op area, I evaluated the patient. I helped with central access. I helped with the breathing machine. I helped with the therapy that was necessary. He moved to the operating room. In the operating room, he got his infection drained as was appropriate, despite being extremely sick. Because of his young age, he made it to my ICU. His organs continued to fail. Because his organs were continuing to fail, he was actively dying. I talked to his wife, who was beside herself, appropriately, grieving. I said, "We have to call his mother. We have to call the family." I grabbed the phone, I called his mother, and I told her she needed to come into the hospital as her 31-year-old son was dying. Family came, entire family, mom, stepdad, brothers, sisters, cousins. I talked to them. I told them his organs were deteriorating to the point of death and that there was nothing that I was going to be able to do, but that he was going to pass away. I kept him physiologically alive. His 75-year-old grandmother, the most elderly person in his family, showed up. And this was the powerful part. She walked in the room. She gave him a kiss on the forehead. Not 5 seconds later, even with being on all the life support that he was on, he passed. He died. The reason I do what I do is because when I was a first-year medical student, my grandfather passed away. He was in the intensive care unit when he passed away. He'd gone in for a small bowel obstruction, but because of emphysema, which we talked about last episode, which is a large amount of dead lung, he couldn't be weaned from the ventilator. My mother asked him during his stay in the ICU, "Dad, do you want to be off the machine?" He shook his head, yes. She then asked him, "But that means you're gonna die." He looked at her in the face and he said, "We discontinued the ventilator. Within the hour, he had passed. I wasn't there. I didn't go home for my family. I always felt like he wanted me to stay at school and work hard." And he was right. I should have worked hard, but saying goodbye was for me. It wasn't for anybody else. It wasn't for him. It was for me. And every time I enter the ICU, and every time I talk to a family at the end of somebody's life, I put myself in the position of my family, and I feel like I'm talking to my own family. And I try to talk and I try to articulate in ways that they would understand. And we talk about death, we're really talking about organ deterioration. The heart, the engine of your body, pumps the nutrition, the blood, throughout the entire body. It pumps blood to your brain, so your brain can think, so you can move your joints, so you can move your mouth, so you can walk along the beach and put your feet in the sand and realize where you are and what you're doing. Then the blood goes down and the heart gets its own blood supply, so the heart can continue to pump. Then the blood travels down a pipe or another vessel. It goes to the kidney. It goes to the skin. The kidney is responsible for making urine, keeping our blood clean. Blood then travels to the liver. The liver is responsible for making all the proteins in the body. It's responsible for cleaning out the blood, eliminating all the toxins from your body. It goes to the spleen. The spleen is responsible for making sure the red blood cells are as alive as they need to be, making sure the white blood cells have a place to travel when needed to fight infection. The skin. We all know what the skin is for. It's to cool us off. Muscles. Muscles are to contract so we can walk, we can run. But as we advance in age, as we get older, as we become more wise, organs start to fail. When a 75-year-old comes into the hospital, sick, and his kidneys don't work as well, we have to remember and we have to respect that the kidney is 75 years old, is deteriorated. We have to remember and we have to respect that the heart is 75 years old. It doesn't pump as well. All of these deteriorations are what lead to ultimate death. Death is a part of life. I'm a part of death every day, explaining it to families, talking to families, doing what I do, doing what I love to do. And the reason that I love to do it is because I was absent during an important person of my life's death. And I regret that. But I try to make up for it every day. I sit in that ICU and I sit with that family and I talk to them about deterioration and why their loved one is passing away or is going to pass away. And it's hard, but I love to do it. I love to deconstruct it. And I really love deconstructing medicine. Thanks for being here today. I'm Dr. JRutland.